Hello, everybody. Super excited to be here with all of you. BTL is hosting this amazing webinar all over the world. Joining us is amazing physicians for today's panel. And we're talking about a topic that is super exciting and always relevant, which is skin. Skin is such a globally massive topic when it comes to pigment, when it comes to tightening. And BTL, of course, is always advancing technology to allow us to provide this treatment ongoingly to our patients in the best way possible. My name is Sam Patel. I am based out of Chicago here in the United States, and I am joined with two amazing world-renowned physicians from France and from Indonesia, Dr. Natalie Fournier, and of course, Dr. Arini Widido. So I'm super excited to have this conversation with all of you joining us from around the world. Thank you for taking your time in your morning, your afternoon, and your evening, wherever you are from around the world. We are so honored to have you and have this conversation with you. With that being said, let's talk about what we're going to be conversing about today. Of course, BTL has amazing technology when it comes to body, when it comes to wellness, when it comes to face, and now when it comes to skin. And of course, BTL is advancing their EXION platform to now include the ability to address pigment, and that is with Clear RF. Now, as we embark on this journey today, we're going to be discussing how EXION has advanced skin, of course, with their radiofrequency microneedling, of course, with face and body, but now going to a much further length to address one of the biggest concerns globally, which is pigment, which is surface of the skin and texture of the skin. And Clear radiofrequency allows us to do just that. As we go about this, I welcome all of you to ask questions. Of course, if you're having technical difficulties, the chat, make sure that you write down what technical difficulties you're having, and a BTL representative will help navigate for you. Of course, we'll also go ahead and ask questions that you might be curious about. We'll do our best to answer those questions during our Q&A panel at the very end. So without further ado, I would like to dive into this amazing topic to talk about how the evolution of skin is happening with radiofrequency and Clear RF. So let's talk about the actual platform. Of course, those of you that are familiar with BTL know that EXION is the most versatile device that they've created in a very long time. Now, why is it versatile? Because it has so many applications. As you can see, we have 4 unique opportunities. Radiofrequency microneedling, the most advanced of its kind, of course, with doing treatments in such a very quick amount of time with very limited discomfort. And now they also, of course, have the radiofrequency ultrasound for the face, for all those delicate areas such as the eyes and the lips. Now, they also, of course, offer radiofrequency ultrasound for the body, for getting rid of those stubborn fat pockets, those areas in the body that we might want to just tighten up. And of course, MFEM, of course, an opportunity that allows us to address intimate health for our female counterparts. But of course, we're going to continue with this conversation with going through how EXION is diversifying even further. Clear RF is the newest generation of resurfacing available on the EXION. So for those of you that have the EXION platform, this is a beautiful addition to what you already have. Or for those of you that are maybe new to BTL and investigating whether BTL technology would be a good fit for you, EXION is the perfect place to start because it has so many opportunities when it comes to skin, when it comes to pigment, and so forth. So as we embark further on this, we want to kind of talk about the newest indications that we can allow treatment for this technology. So we'll be diving into a little bit of how we can treat and what we can treat and the recovery of treatment. Further, the clinical studies and science, because as you all know, BTL is very big about data. They're very big about making sure that there's proof behind anything that they are, of course, claiming. And of course, there's so many world-renowned experts, many of that are joining us today, actually, that have written amazing articles and data science papers to allow us to show you the evidence. And we'll be talking about that evidence today. But it's not just about science. It's also about your business, making sure that we can elevate your business to another level. So we have to consider clinically, how is this technology very superior? And also as a business owner, how is this superior? So we're going to talk about both of those in a lot of detail today. So of course, we have our two speakers as I've introduced, and I'll introduce them into a little bit more detail as we come about. But I'm super excited because we have, of course, amazing dermatologists from all over the world, people that have really taken this industry further, pioneers. And I'm so blessed to be helping moderate this panel. And I'm very honored for all of you to have the opportunity to really hear from them because their expertise is priceless. Now, as we go about this, we'll experience a little bit more about how it is to put it into a laser clinic, how it compares to other technology, the business perspective, and at the very end, we'll be answering some questions. But let's go ahead and dive into this amazing evolution of EXION with Clear RF. So, Clear RF, what is it? Well, as I mentioned, it's the newest generation of resurfacing technology. It allows us to really bring another opportunity to our practice. Now, of course, for those of you that know EXION, we know that it has this AI capability. It's a very smart device. Now, this is smart microablation technology. It allows us to control this amazing treatment for the skin with precision and, most importantly, with consistent results, because consistency is what patients want and what they deserve. And the EXION Clear RF provides consistency every single time. Now, it is huge, not just with results, but fast healing, because all of you know it's really important to give results, but it's more important to give a good experience. Patients want a really good experience. They don't want to be in pain. They don't want very long recovery. They want to go back into enjoying their life, and they don't want to have pain, or they don't want any sort of downtime. So keeping downtime as limited as possible, keeping their comfort as high as possible is so critical. And Clear RF does just that. And that's what makes me so excited about this technology, because all of us know there's so many skin and pigment and resurfacing technologies in the world, but there's none, absolutely none, that are so focused on patient experience and fast healing. And Clear RF is now the solution for just that, enhancing the patient experience with the most amazing results. So let's talk a little bit more about how Clear RF technology works. As I mentioned, it's a smart microablative technology. As you can see here, it's very superficial, focusing majority of its energy distribution in the epidermis, about 200 microns. So we're not going super, super deep. It has these very sophisticated 64 applicator pins, and these pins are very, very, very highly built by the BTL engineers to make sure the energy is properly distributed right into those 200 micron depth of tissue. So what we're doing is basically it removes fractionally damaged superficial layer of that top layer. So we want to remove that, allowing for better healing, but also amazing pigment opportunities, retexturing opportunities. So let's talk a little bit more about how this compares to the other things that we may be used to, such as radio frequency microneedling or fractional RF. Of course, fractional RF is a lot more minimally invasive. Of course, we're going into the dermal tissues, as you can see on the right side here. But with Clear RF, we're focusing our energy distribution right at the surface, right at the top, which makes it very comfortable and very easy to do. So a little bit different than our usual platform, but this allows us to address all the different layers of tissue. We're always so focused on regenerating the dermis, the dermal tissues, increasing collagen, increasing elastin, and those things are important, and we have technology to do that. But what about the top layer of tissue? What about resurfacing? What about the reds, the browns, all the different pigments? We've always focused all of that attention on lasers, but why not focus that attention with using Clear RF? And that's why this is so exciting, because this technology is smart and it has precise energy delivery. For those of you that are used to lasers, lasers are amazing, but there are some challenges. The challenges are it's a lot of work, it's a lot of effort. Sometimes you have to have a chiller, you have to have a smoke evac. There's a lot of other devices you have to have in the room. Sometimes it's very uncomfortable, not just for the patient, but also for us. With this has very smart AI-driven technology that allows us to deliver energy very precisely every single time. Now, why is this important? This is what provides us consistency, because we know that the AI technology is going to do its best to deliver the best amount of energy every single time. With every pulse, We're going to make sure we deliver the energy properly. So we're not guessing. There's no wondering and there's no guessing. The technology takes over that and makes sure and ensures the technology is distributing energy to the tissue perfectly each time, which is what the consistency comes from. So as we figure this out, we have to make sure that we have control and we're preventing unnecessary damage to the tissue. This is why lasers sometimes can be a little bit frightening. For those that maybe have limited skills with lasers, this allows us to make sure that someone that has a decent amount of skill can have the best amount of performance because the technology really takes over the treatment. So that way the operator doesn't have to worry about damaging tissue. What does this all mean? Very simplistically, it minimizes the patient downtime because now in today's world, people want a very fast turnaround time. They want an amazing treatment with amazing results, but they want it very fast. And they don't want to go through very long weeks and weeks and weeks of recovery. This is why it's super exciting. So now let's discuss the pyramid of how this technology works. Now, there's so many opportunities, as you all know, with M-Face and EXION Face and EXION microneedling and now Clear. And this is such a beautiful depiction of all the different layers we can address when it comes to the foundation with M-Face, tightening the muscles, toning the muscles to achieve a beautiful lift, going to the dermal tissues, things that we would typically use, such as hyaluronic fillers or, of course, dermal fillers, and then going one layer up now to finally address pigment and texture. And as you can see here, we're able to do just that. Now treating every single layer of the tissues. So as we proceed, we want to make sure that we understand some of the results and what that looks like for us. So let's take a look at just that. Now, you can see here, there's, of course, the downtime and the journey, and you can see the downtime over progression of days. This is what's beautiful, is that after the treatment, of course, there's some redness. That's where the energy is really soaked into the tissues. Look at just a few hours afterwards, how calm that face looks like. One day afterwards, you're starting to see a beautiful pigment coming up to the surface. And then 2 days after, very fast recovery. Here's another one that you can see here of an 8-day span. This is remarkable. Right after, of course, that nice, beautiful redness, look at this pigment coming to the surface, having this sort of repair happen very innocently, but very elegantly. Now, day 3, we're starting to see that beautiful new skin regenerate, that pigment starting to have more clarity. And then day 8, this is phenomenal results. It almost looks like she has makeup and she has not had a single piece of makeup put on. This is beautiful results from the Clear RF. Super, super exciting to see how quickly patients can recover with limited downtime, maximum amount of comfort, but the best results along the way. So let's kind of quickly talk about all the different opportunities that, of course, the Clear RF allows us to do when it comes to things such as sun damage, because we know no matter where you are in the world, sun is something that we have to consider and the damage that happens to our tissues thereafter. So the brown spots allows us to address this. Red spots we can address with Clear RF, uneven skin texture and rhytides. So why is Clear RF ideal for these concerns? Well, it replaces the damaged pigment cells with new cells. As you saw with the photography I just showed, of course, that pigment coming up to the surface, sloughing off and allowing this beautiful, beautiful, even tone to be produced, smooths and tightens the skin, and of course, balances or rebalances inflammatory mediators in the skin to reduce redness, which is beautiful for those rosacea patients. So here are a few quick results from Dr. Diane Duncan, amazing, amazing plastic surgeon. You can see her patient's results here with the beautiful redness and nice even tone. Wonderful results here with, of course, the brown tones, those more pigmental tones, bringing nice evenness. I love this one, showing sort of this retexturing ability with those necklines along the way, providing this nice, smooth texture to where it doesn't feel like it has to feel aged. It feels very youthful, very regenerated. Oh, this is such an amazing one. You can see this beautiful transformation in the midface, specifically with the pigment, providing this nice even complexion, but also some nice texture and tightening appearance as well. And you can see here with the brown spot improvement specifically how that midface has significantly changed by this treatment after the third treatment. In the reds, beautiful improvement. I mean, completely obliterated the vasculature and the redness. This is something that has really truly transformed how we look at performing treatments for pigment. Now, let's quickly touch on the results before we introduce our next speaker. And of course, BTL, one of the beautiful things that I personally love about BTL is their dedication to data and science. They have over 500 engineers globally that work tirelessly to produce these technologies so all of us can enjoy performing and all patients can enjoy receiving. But with these engineers, they not only have a lot of them, they have a lot of clinical investigators that are solely dedicated to proving and showing data, as you can see here. 48% improvement in brown spot reduction at 3 months, 42% skin texture improvement at 3 months, 25% right tide improvement at 3 months, and high patient satisfaction, which is what I love to see, is making sure that we can get results, but that patients love receiving the results just as much. Now, of course, the clinical data shows, and you can see here, those brown spot reductions over that 3-month span. You can further see here, oh, wow, look at these results, the redness calming down, providing this confidence to this patient and this amazing glow, not just how cosmetically this transforms life, but think about the emotional aspect and how this transforms people emotionally as well, because now their confidence is boosted. So cosmetically, amazing, but confidence-wise and emotional, also amazing. BTL is really transforming lives all over the world. You can see here the right tide reduction, 25%. Amazing, amazing results here by Dr. Cohen, amazing dermatologist. Now, let's go into more discussions with other physicians from around the world. Now, I have the honor and honestly amazing, amazing dermatologist that I had the pleasure of meeting in Paris. She is from France. Dr. Fournier is well beyond the scopes of dermatology. She has been a pioneer in this industry for a very long time. And in all honesty, it's an honor and a pleasure to have the opportunity to be with her today. It truly is an honor to be with you, Dr. Fournier. She's an award-winning KOL. She lectures globally. She's a researcher, fellow member of the American Society of Laser Medicine and Surgery, member of the European Society for Laser and Dermatology, aesthetic medicine expert, international trainer, medical researcher, and she's a clinical investigator for MFACE, Emscope Neo, Mtone, and EXION. I don't think I need to say more. Her reputation precedes herself. Dr. Fournier, take us through some conversations when it comes to these technologies and integrating it. I will hand the platform over to you. I appreciate having you today. Take it away.
Hello. Thank you very much, Dr. Patel, for this introduction. So glamorous. And in fact, I don't know if it's nice to be treated like a pioneer. It means you have spent a lot of time in this field, but this is true. So by the way, I have, sorry, I'm looking at this. Yes, I have clinic in the south of France, nearby Montpellier. And the sun damages are very a concern in my place for my patients. And I have now about 4 years of experience with EXION. I have all the applicators, of course, and I'm very satisfied with this device because I obtain great results for my patients. They are very happy. They renew treatments. They come for maintenance treatments. So it means they are really convinced of the efficacy of the device. And the latest innovation, the Clear RF, for resurfacing with good result, but not too much downtime and not too much pain, was really a big opportunity that BTL offered to the physician who utilize EXION. So in fact, it's a new resurfacing microablative procedure, and the question is, why do you use it in a clinic who has already lasers? Why? Because even with fractional CO2 laser, which is a really good tool, and I really love to use it, and I'm very good in practice with it, finally, you have quite a downtime, and it's quite uncomfortable. And of course, you get good results, but you need also multiple sessions. And finally, at the end, I'm sure that you can enhance your result with less downtime when utilizing the Clear RF as just the Clear RF alone, a standalone procedure, or also in combination with the CO2 laser. So yes, Clear RF is really useful in a clinic with laser. How does it work? So you can use it mainly as a standalone procedure, but also as a fractional radiofrequency microneedling in combination, and also with fractional CO2 laser. And when do I use it alone? I use it mainly, well, you can use it on every phototype, but I use it mainly on 1, 2, 3, when it's just a skin smoothing and a light abrasions with fine lines, with brown spot, with a little red spot, and no skin laxity. Also, I use it on thick skin and wrinkles and with acne scar, of course. And the indication mainly will be barcodes, crossfeet, front lines, jaw lines, acne scars. About the pain management, I use anesthetic cream, but the patient can just apply it very quickly, half an hour before coming to the office. And we re-put it here 15 minutes before, and then I do treat them. It's easy. It's not, you have to keep them 1 hour in a room, etc. Depending on the settings, you can have a recovery of 2 days, as showed by Dr. Patel, but you can also have a recovery to 7 days. It depends on the settings. It depends if you do one pass or multiple passes. For instance, on this woman, I used on the barcode 3 sessions of Clear RF alone, and at 1 month interval. And she got quite a good result. She was very happy with this result. And she's a phototype 4, and she's always suntan. You cannot reach her skin without tanning. And so treat her skin without tanning. So in fact, even if she's a suntan woman, you can get that result without risking having hyperpigmentation. And this is quite different than with the fractal CO2 laser. And of course, you will see that it's due to the histology, which is really different. When do I use it with fractional microneedling combination? It's when you have a skin laxity, because the Clear RF is a microablative procedure, but not a skin laxity treatment. So if you use it in combination, you will have the perfect result. You will get really a synergy of the two tips, and you can either use, like I show in this protocol, typically 4 sessions, microneedling, 2 to 2 weeks interval, then Clear RF 1 to 2 sessions, 3 to 2 weeks interspace. But you can also sometimes use on one of the session microneedling plus eventually Clear RF. I will show you why. And so this is a patient. She was 74 years, phototype 2. And this is the way I use, you can see the protocols. I use 2 sessions, fractional microneedling, non-isolated needle, multiple passes on periorbital and perioral area. Multiple means 2, sometimes 3, but very barely. And 1 session of fractional microneedling, isolated needle, and then I use over that 2 passes crisscross on periorbital of Clear RF. She had 7 days recovery, but you see her result is really impressive. And this is a young man, and so for this type of lesions, he wanted to treat the T-zone and the periorbital area. He had only 3 sessions of fractional microneedling and 1 session of Clear RF, and all 1 month apart. And this is before and after, 3 months after. He was very satisfied of the treatment. Another woman, you can see this woman, her concern was mainly the brown spot, also the wrinkles, the skin laxity, And she got quite a good result after this protocol, 2 sessions fractional microneedling, 3 weeks interval, and 2 sessions then of clear RF before and after. Another woman, 57 years, prototype 1. She had some skin laxity also, so she had the fractional microneedling 4 sessions and then 1 session of clear RF. In all these patients, I use only 1 pass with the clear RF. So I explained because I introduced the sequence with you can use it crisscross, yes, but in very rare cases when you have to enhance the result and augment the number of spots to be treated. Then when you combine it with CO2 laser, you can combine it because this will be 2 mechanisms of action, so it will increase the clinical result on difficult indication. But as Dr. Patel said, you have to be good in laser. Don't improvise for that. If you need more abrasion and if you need a deeper effect in the dermis, so you will use it for difficult barcode lips, sun damaged skin quite deep, and brown spot quite deep. Then you can do 2 to 4 sessions of clear RF alternated with fractional CO2 laser. And this is why you can mix them, because you can see the combination will be able to treat the superficial microablation epidermis, microablated epidermis, and also the dermis with a thermal damage located strictly in the deep dermis, medium dermis also. So you will have a full effect. This is a young man. He could come only because he's living very far at 6-month interval. So he did 1 session of clear RF, then 6 months after another one, then 1 section of fractional CO2 laser. So you can see that he has much less laxity on the corner of the eyes, the external corner, so the crow's feet, and also he has a more regular skin in this area and more toned skin. So you can see that even if you do the treatment very much spaced, you will have a result, even with a space of 6 months between the session. So it means what you got with the clear RF, you got it, definitely. Another woman, she's 72 years old, prototype 3, and she did 2 sessions of clear RF at 4 months interval for the same reason she's living far, and 1 session of fractional CO2 months after, and on the half inferior face. And she was very happy with her result. All these patients that I show you, they didn't have any injection. They do not want injection, I mean fillers. Some had some Botox, but fillers they don't want. So clear RF is really a solution for helping to remove wrinkles and even on the neck, and also to smooth the skin, remove the brown spot, remove the red spots, and it means that you can really enhance your result despite the fact that you have other tools. Like you can also combine the clear RF with some people, they have also other devices for ablation, like the Tixel, and you can combine it with it. There is no problem also. And also you will not risk any kind of hyperpigmentation. So I combine, this is my favorite combination, clear RF plus fractional microneedling plus M-Face. Wow, so I can smooth the fine lines and wrinkles, treat the sagging skin, reposition the face volume by treating the elevator muscles. And so it will be, what are the indications? Sun damage with brown spots, of course, improving the cheek's global appearance without fillers, smoothen the barcode lips, and improve the quality of the skin. My protocol will be to do the M-Face first, 4 to 6 sessions at 1 week interval, then the 4 sessions of fractional microneedling at 1 month interval, and then 1 or 2 clear RF sessions at 1 month interval. I finished by that. But you can also do the contrary. Do the clear RF before the fractional microneedling. So because in this case, they will have an immediate effect on the pigmentation. So if they have only wrinkles, you can do this protocol. If they have also brown spot, you can do the clear RF before the fractional microneedling, because it will give immediate result, patient will be satisfied, and this will push them to continue the full protocol. This is a woman of 61 years, phototype 2. She had 6 sessions of M-phase, fractional microneedling. She had 4 sessions and 1 clear RF, 1 session only, because she didn't have much brown spots. And she was very satisfied, so much that she did a witness talk on my Instagram, because she was really happy. Another woman, 69 years old, phototype 3, 2 sessions of clear RF at 6-month interval, 1 session EXION fractional microneedling, and at 6-month interval, and 4 sessions M-phase at 1 week interval. This is a before and after, 1 year after. You know, and you can see she has the smile, and she has her cheek higher, because in fact she continued to do the maintenance session of the M-phase, and she didn't need any kind of fillers. By the way, she didn't want any filler. So this is really interesting in terms of that. So my conclusion is about the tip clear RF. It's a kind of final touch. When you have lasers on other tools, you can always combine the tip clear RF with EXION, and to get a happy patient. And thank you.
Thank you, Dr. Fournier. I'm blown away. I was taking notes, and I was trying to listen to you at the same time. I've learned so much in such a short period of time, and I hope everyone around the world was taking notes, because this was absolutely brilliant, showing how this clear RF can be beautifully combined with all the other different technologies we have. Not there to replace anything.
No.
It's more so to enhance everything that we have, enhance all the other technologies. Providing combination therapy is necessary and it's critical. And that was so brilliantly done. Thank you, doctor, for going through that. I think it's so great to hear your expertise and how you've integrated this technology with amongst all the other things to enhance your results. And those were quite fascinating results. So we appreciate you. Let's move towards the next conversation. And of course, we have Dr. Arini Widodo from Indonesia. And oh wow, I mean, the background for doctor here is quite fascinating as well. She's an award-winning dermatologist. She's the head of the Department of Dermatology and Aesthetics. She's a researcher, lecturer, and KOL, and she has a lot of amazing knowledge when it comes to everything skin. Doctor, I mean, your skin is amazing. I bet you've done clear RF, and it's I can't wait to have this I can't wait to have this conversation with you. Without further ado, I just want to hand it over to you, because I'm ready to take some notes along with the rest of the world. So let's go ahead and go into your expertise, your background, and a little bit more about your experience with EXION Clear RF. Take it away.
Thank you, Dr. Patel. And then what a great result by Dr. Fournier. I'm also blown away. And then I think what I'm going to talk about is more like on a business and a marketing side that I did with EXION, and specifically Clear RF. So without further ado, we know that there's an evolution of aesthetic technology. So first, they invented lasers, and then IPL, and then RF, and then ultrasound. And then now the latest technology is to combine them all with AI. So now we have EXION, which is this 5-in-1 pioneer of innovations with monopolar radio frequency, targeted ultrasound, also with AI integrated. So what I did, I'm leveraging innovations for my clinic growth. And then by leveraging the innovations, we become like the trendsetter. We enhance patient outcomes, we expanded treatment portfolio, improve accuracy, and then also increase the clinic credibility. So the innovations that currently available is what I'm looking for is an AI-driven device with advanced EBD, creative combination treatment, on rarely mentioned area. And also we combine it with regenerative medicines. And then I did it all only with one device, which is EXION. So if we want to become like the solutions of our patients' problems, and then most of my patients' problems, I wrote it down here. So this is almost all the problems that my patient mentioned, which is tagging, laxity, blah, blah, blah. And then with the new, and then all of these problems can be fixed with one device, which is EXION. And then with the additional Clear RF, we can tackle textures, uneven skin tone, dull skin, dark spot, which it completes everything. You just need like one device in your practice, and then you can fix all of this. And then this is the difference of how it works. And then I think Dr. Patel has explained us how it works. And then basically I want to say that like EXION is the star in my clinics because it's the convenient, how a single device, and then it can cater all the multiple concerns of my patients. And then talking about skin quality, there are 4 emergent perceptual categories in skin quality. And previously, EXION really helps with skin quality. And then it was very good to improve the skin firmness and skin glow. And now with the Clear RF handpiece, we can even treat the skin tone evenness and skin surface evenness, which makes it a holistic device to improve skin quality. And then talking about resurfacing technology, and we know that like the resurfacing trends is still rising. This is the data, and then we see now we're 2025, and then it will still rising until 2030. And then this resurfacing laser was one of like the most looked after treatment in my clinic, and also I believe in most of the clinic too, because it's delivering prover and powerful result. But it does require advanced physician expertise because we should understand like the energy, the pulse width, the depth, and everything. And then it was invented, the fractional laser was invented around 2003, which is already considered a mature modality. It's great, and then I think most of my patients did it already, and then it's great, but it's not new. So now people looking for new stuff, and then 2025 is the year of like skin quality, and we're looking for redefining resurfacing. So with the Clear RF, we want to reintroduce the resurfacing technology, not deeper, but smarter. So the aesthetic patients today, they are educated, they are highly selective, they demand visible, but also natural results. And then they prefer innovation that don't look treated, values efficiency, and then multi-purpose treatment. And then this is the example of the new aesthetic patients today. And then look at her previous problem, epidermal pigmentations. So what makes her look becomes transformed is one of them is fixing her epidermal pigmentations. So Clear RF, I define it as like resurfacing meets pigmentology because it caters both. So the downtime is minimal. It's like a downtime of mild CO2 or erbium-YAG, but it has a superior pigment clearance. And the good news is it has more predictable result than lasers. And it also has the benefit of enhanced drug delivery. So I combine it with lots of regenerative medicine modalities to improve the result. So why Clear RF fits more than aesthetic business? Because most of my patients already trust the brand, BTL, EXION, and then it's easily cross-sellable. It has the triple action purpose, resurfacing, pigmentations, and also enhanced drug delivery. And then it's easily packaged. So there are three pillars of the clinic growth with Clear RF, which I want to share with you from our experience. First is the Clear RF is the first AI-driven precision smart microablations with monopolar RF. So, and then it brings new opportunities. And then how we make like this new innovation drive our business growth is by doing good marketing, visibility, and then we attract new demographics, and then we do the upselling so that it will increase our ROI. So the EXION treatment in our clinic, even before the Clear RF came, is already break even in 6 months. But then if you see, in November, there was like a little bit decline because most of my patients did it. And then with the new additional handpiece, actually the number of patients bounce back. The number of patients who want to try EXION new device, the new Clear RF handpiece is increasing, and then it brings more profit to the clinic. Talking about the patient sources, it's not only we can resell it to those who love EXION, but also those who have pigmentation problems. So my previous patients who did pico laser, who did chemical peels, or my old patients who have texture problems, like who I did like fractional erbium yak, CO2, microneedling, etc., etc. So I sort of like offer them like this treatment. I said, this is a new treatment. So they love to try it. And then the second pillar of clinic growth by Clear RF is I introduce it not only to the face, but with on a wide range of body concerns. So because we have a lot of shot in one hand piece of RF, which is 800 shot, and it's so much for the face. So that's why I extended it to offer it to hand, neck, and other parts of the body. So we can maximize with like, this is, for example, this is for the neck. This is for hands, this is for the chest, and also we can do it for the arms. And the third one is strategic utilizations, which I think Dr. Fournier has shared her amazing combination treatment. There's a lot of options on combining Clear RF. We can combine it with all the lasers that I have in my clinic, like pico laser, ND-YAG, erbium YAG, focus ultrasound, LED, light therapy, injectables, PRP, exosomes, etc. I mean, it's very flexible treatment. So this is just sharing the bundling that sells in our clinic. So for example, for pigmentation, I can combine it with pico because we know that Clear RF is very good for epidermal pigmentations. But those who have both dermal and epidermal pigmentations, I use both. So I can treat both at the same times with also depigmented with topical drugs. And also, for example, for like a skin glow, I combine it with skin booster. For skin quality, I combine it with EXION face. And for skin regeneration, to enhance drug delivery, I combine it with exosome, secretome, PRP, etc. It depends on the drug that you want to enhance the drug delivery. And then I also do the face and body combo. Why? One of them is to utilize the numbing cream time. So when the patients use numbing cream prior to the Clear RF, I offer them sort of like treatment for body, so it saves time. So it's sort of like a strategic utilizations of the time. And then by combining with other BTL technologies that use PET, like M-Face or like EXION Body or EXION Face, we reduces the PET use per treatment. So it's actually save our COGS or save our cost. And then it also increases the satisfactions. So this is like one of the results. This one is combining microneedling RF EXION with Clear RF. And this is only one-time Clear RF. Only one-time Clear RF. You can see like the reductions of her lentigines. This is the reduction of her solar lentigines and freckles. And then this is how it improved the pores and wrinkles. And this is only like one-time treatment with Clear RF. This is only one-time treatment, and then this is also with one-time treatment. We can see that her epidermal pigmentations decrease, but also her skin tone is also improved. This is the skin analyzer PCR results. We can see that the spots are improving, wrinkles are improving, texture is improving, and then the pores is also improving. In these patients, I combine it with 1064 pico lasers because she has hoary nevus. And just want to share like the last one. This is how I use this innovations by EXION as a catalyst to drive out my clinic growth. So I started to creating and utilizing the innovation from EXIONs when I sort of like rebrand my clinic. So I opened this new brand just a year ago, so May 2024, and then I'm using like the campaign Aesthetic Intelligence, where I sort of like connected with AI. So we brand it as like the first clinic in Jakarta who sort of like integrate AI in a clinic. So what I use is like I'm using like the skin analyzer based AI, and then I'm using EXION, which is an AI based technology. So when I did it, I sort of like patent and trademark the aesthetic intelligence and how I'm using AI in the clinic. And then when you have an idea, and then you want to be loud, you want to be heard, because otherwise people would just like steal your ideas. So what I did is I sort of like going more into media, because one day I came across this Instagram of one of the American rapper, and then he posted this on Instagram. So being famous on Instagram is like being rich in Monopoly. So it sort of like changed my perspective about marketing in my clinic, because in social media, people just look at it once and then they forgot. So I want things that last longer. So I do a lot of things on as my marketing effort. It's more like a media campaign, so doing a lot of press release. So we did in 1 year, we did 3 press release, media gathering, also features in magazine, 2 cover and 4 articles. And then we also did a digital presence like YouTube and Instagram collaborations with partners. And then this is the examples of the cover stories. As you see, I'm promoting EXION on my cover story. And this is the articles from the magazine. And we also highlight patient experience. And this is our events throughout the years. There's a media gathering, brand collaborations, and then reopening and then rebranding my clinic, because AI is now very trending, and then I want to integrate AI in a clinic. So I feel like I need to do my clinic a rebranding. So this is the examples of the articles we use. And then we also do a patient-centric promotion, celebrity partnership, and then by all of that effort, we got industry recognitions, and then we got 2 awards, and this is the first award. And second, we won this Female Daily Beauty Award, which EXION made it as a Best Treatment of the Year by Female Daily Best of Beauty Award 2024. And then after succeeding with EXION, and then we moved to introduce the Clear RF to the market. So what we just did along coordinating with BDL Indonesia, we made it into a magazine cover, which is a Harvard cover. And then we did it with a very famous actress in Indonesia. And then we do it like on a different style because we want to introduce the EXION not only for older population, but also for younger populations, because so make it more like a lifestyle. And then to tell the public that it's not sort of like only anti-aging devices, because it fixes pigmentations with because freckles, I mean, like mostly those who have freckles, they are like on their 20s, on their 30s. And then on that cover story, we also introduced Clear RF as the highlights. And this is one of the example of our Instagram collaborations with high-profile individual. And then this is the example of our KOL and public figure for EXION. So as you see, they are young, they are on their 20s, but we mix it with actor and actresses, which is like 40 years and above. And then this is another samples of the high profiles individual. And then we also include customers' testimonials on our post. And for patients who perceive EXION Clear RF in particular, they usually love the results. But the downside, some of my patients feel it's still a little bit painful for them. So we offer a comfort solutions along with EXION Clear RF. So aside from topical anesthesia, we also offer a nerve block service, happy gas, also an intravenous medications with only contains of ibuprofen and paracetamol, but that really helps and it makes patients a lot more comfortable. So concluding my experience with EXION Clear RF, and EXION has just been in my clinic for a year, and Clear RF is about like 5 months. Patients love the results. So the skin becomes brighter and smooth, and then without looking overtreated. And then it's very good with patients with superficial pigmentations, uneven skin tone, rough textures, and then those who wants to try new things other than lasers. So I think there is some highlights when I market Clear RF, which is, I think this is the new kids on the block, because this is an AI microablation resurfacing with monopolar radio frequency, which I think there's no device yet in the market that works exactly the same. It's also AI power. It's a smart microablations with intelligent system. It doesn't need any needle. It's not laser, and then it fixes multiple problems like pigmentation, wrinkles, skin tone, pore aging, and texture. So I think this is a pioneer in redefining aesthetic, especially resurfacing. So when you have new technology, my advice is be the first to get it, because you will lead the game. Thank you.
I'm blown away. Dr. Arini, that was fascinating, because the business piece is something that a lot of us don't talk about. And this, of course, these technologies are amazing for patient care, but they're brilliant for advancing our business, to advance our practice, to advance our opportunities. And I am honestly blown away by how much you have integrated this into your marketing, into your branding, into your way of doing treatments. The things that I've taken away is obviously combination therapy. Both of you have done brilliantly to discuss how combination therapy is so critical. Comfort, fast results, technology that's backed by science, one device to fix everything, a whole platform that allows us to address multiple concerns, making it very convenient for us as the operator, one technology, but also the patient to have multiple opportunities. And one thing that I absolutely love was how it's not just about the face, but it's also the neck and also pigment on the hands, because we can fix pigment on the face, but we have to even it out with the neck. And certainly we can start to see aging when it comes to the hands with pigment. So if we can correct that, resurface other areas of the body, This is honestly one of the most exciting technologies I've seen with skin in a very long time, and I appreciate both of you. We're going to dive into a lot of questions with the remaining time that we have, so thank you all for being so patient. And as we go through these questions, we'll do our best to answer them. Number one that we had was, with either of you, and this really goes to either doctor here, any experience with sort of more body-related concerns when it comes to stretch marks? Any sort of applications of use there? Have you used it there? Do you feel like it could be used there when it comes to effects on stretch marks? I would love to hear either of your opinions.
Okay. Okay, I begin. On stretch marks, I usually do the fractional microneedling plus the Clear RF on it. It's helpful when the stretch marks are quite wide and with laxity and with atrophy, because it will help. It will help a little bit, not as 100%, but it will help to recover thickness in the skin and also to diminish the largeness of the striae.
Mm-hmm. Dr. Arini, any further feedback on that?
Yeah, I use a lot of like microneedling RF by EXION for to treat the stretch mark, and then I usually combine it with collagen stimulators, which I think it's sort of the perfect match. And then I think it's different than in Europe. In Asia, we have a lot of darker skin types.
Yes.
Which I think it limits the use of fractional CO2 because it creates a lot of PIH in my patients, and then they become very traumatic. So I would prefer to use microneedling RF combined with like skin boosters, a collagen stimulator, and other regenerative medicines because it enhances drug delivery. So I would use sort of like a PRP, exosomes, secretomes, so those sort of things that would improve the regeneration as well.
Yes. Mm-hmm.
Absolutely. Love that feedback. How about melasma? I know there's a lot of questions that have come through about, is this something that could be safe to use with patients that have melasma? Experience with both of you there?
For me, I don't treat melasma very often, except by topics or sometimes by tablets. But I can try sometimes the Clear RF. I'm not convinced of the fractional CO2 laser for melasma because it has very often a rebound after. And so for the Clear RF, I can use it if there is a strong percentage of pigmentation and not much in terms of inflammation. So it depends on the melasma. But I don't treat very often melasma. People come to me for other things than that. Mm-hmm. More for aging, skin aging. Mm-hmm.
Right. Dr. Arini, any experience with melasma for you?
Yeah, I think in Asia we have more melasma because of our skin types, and then we do sometimes have more melasma than epidermal pigmentations. And in melasma, we do it actually strictly by guidelines, which the first line is topical, which the first line we use topical, and then we combine it with, for example, like tranexamic acid, etc. But we also use devices. So for melasma, there's an epidermal melasma and dermal melasma and mix of epidermal and dermal. So where the Clear RF stand is on epidermal melasma.
Absolutely.
How you determine whether like this is epidermal or dermal? If you have like a skin analyzer like Physia, like I did in my clinic, it helps because it sort of like show which one is the epidermal and which one is the dermal pigmentations. But also if you have sort of like dermoscopy or UV, you can see whether like the melasma is more epidermal or dermal. But Clear RF definitely helps with the epidermal melasma, and microneedling is actually helps melasma by improving the skin barrier. So in melasma, there's disruptions in skin barrier, but just with melasma, we cannot be too aggressive. So in melasma, I only use it like 10 to 20%. So with minimal heat, but just using the microneedling to improving the skin barrier and then promoting the collagen, which makes the fibroblasts healthier.
Okay.
It makes perfect sense. No, the science behind that is intricate, but how you explain it was certainly very simplistic. So I appreciate that. How about I know Dr. Arini, you mentioned about pain management and making sure the comfort level is maximized with Clear RF. Dr. Fournier, I would love to hear sort of your take on the strategy of pain management for patients while they're undergoing treatments with Clear RF.
Well, usually I just use MLA cream. My assistant put it on the patient. We keep it in a room with some plastic over their top, so it enhances the penetration of the cream. But that's it, you know. We don't do block nerves. The anesthetic illyrating gas is not very popular here. It's even not well perceived by the patient, so I don't have it. I tried it, by the way, and so not me, the patient. But in fact, I don't feel comfortable to use it, I must say. And so only topical cream is enough. Really, it's not a painful procedure. It's very quick also, and it's much less pain than the fractional CO2 laser, for instance.
Absolutely. I always say it's a little spicy, but it's certainly, you know, it's topical. It's certainly sufficient enough. I don't think, you know, going to larger depths with having to do aggressive pain management is necessary. That's, I think, what the beauty of the technology is. Dr. Arini, in terms of the revenue generation piece of this, have you seen that it's, you know, more advantageous to do a series of treatments, like a bundling and having maybe every month, or doing one treatment at a time? How do you navigate sort of these conversations with the patients? Or also, how do you navigate bundling things, whether it's one treatment at a time or let's do 3 and then maybe stretch it out for a period of time? What is your sort of advice on that?
Well, we offer both series and bundling. But what I see when I treated the patients, it's, because the tip has like 800 shots. And then when I do like the whole face, it's maximum 300 shots. And then, you know, I don't know, Asian patients, they have small face. So I don't use it that much. So I'm trying to do sort of like bundling with other body parts and then utilizing another BTL device that uses PAD, which sort of like monopolar device, and then like M-face and everything, to sort of like make it more efficient, economic. And then it depends on, because like in series of treatment, it depends on the cases. For example, you see how much the pigmentation she has, and then you already told her, oh, this one is 4 sessions.
Right.
But sometimes, you know, when they have sort of like, you know, they are young, they are on their 20s, they just want to have more even skin tone. Sometimes you don't have to use that much. So you don't have to have that many sessions. So I offer them bundling instead. So if they want sort of like a skin quality, for example, so I offer them more as a bundling. For example, like the EXION phase and the Clear RF after.
Yeah, makes perfect sense. In terms of combination, and this question is for either of you, if someone is undergoing radiofrequency microneedling, is there a certain time period they should wait before also doing Clear RF? Is there maybe same day? Do we have to wait a few weeks? What is sort of your experience or either of your experiences when it comes to combining radiofrequency microneedling with Clear?
As I told you in my previous slides, in fact, I can combine it the same day, you know, if you use insulated needle, because otherwise it will be some thermal damage too strong for the skin, and you risk eventually some scar. So I don't recommend to do that. You have to have a good skill with the device EXION to do that. I recommend to do the EXION microneedling, and then maybe a week after, because after a week the skin has recovered fully, you can do the EXION Clear RF, for instance, you know. But in terms of money management, and also the fact that the patient cannot come every week for some of them, usually it's one per month. It's one session per month, you know. But it can be other, because after a week the skin has recovered from the microneedling, so there is no problem.
Absolutely.
But you can use it the same day also.
No, makes perfect sense. A couple more questions we'll go through. I know we're just wrapping up here, so I appreciate everyone's time today. We've been focusing a lot of this conversation, of course, on the beautiful nature of providing pigment opportunities with reds and browns. How about the tightening effect of clear? Are you seeing sort of an advantage? Of course, we know we utilize, of course, radio frequency microneedling to help with more of the tightening concerns. But what about clear RF? Are we starting to see, in your experience, what is that tightening effect? How does it look like for your patients?
But for me, it's not really a tightening effect. It's not deep enough. For getting a tightening effect like the CO2 Fraxel, it will. I always, if I want a tightening effect for the skin laxity, I always add some sessions of microneedling or some session, as you say, Dr. Irini, of monopolar EXION phase. I use the combination of the bars, but not the clear RF alone.
Yeah, makes sense. Dr. Irini, what is your sort of experience or consideration for that?
Yeah, I think same with Dr. Fournier, because for tightening, I usually prefer EXION phase and microneedling RF, and then followed by clear RF sometimes after.
Absolutely. So we'll do one more question. With the last question, both of you touched on this, and I think we're all excited about how clear RF has been introduced into our practices and our way of doing treatments. How do you feel that this clear RF technology has given you all a competitive edge in today's market? Dr. Irini, you mentioned, lead by example instead of waiting around, do it first. And then Dr. Fournier, of course, you had experiences with different technologies. I would love to hear final thoughts with both of you in regards to how you feel this technology keeps you relevant, keeps you ahead of the game, and keeps you competitive in the marketplace.
Well, for me, of course, it keeps me competitive, and I really trust the PRF team for that because it's new and it's a new way of resurfacing. And it's, as you mentioned, Dr. Irini, the AI, which is very important. It's a concept I will put more on the top now because I was not using it enough as a convincing argument for the patient, but it is the convincing argument. Thank you for saying that. And it's a clever tip. So yes, I'm really convinced it's helpful. And as you mentioned, I do a campaign every time there is a new thing, a new tip, And so once I finish one, I begin with the other one. And so I will do a new campaign for the clear RF. That's my conclusion. I'm sure it will enhance the number of patients I get for the EXION. But anyway, the EXION in my office is the device that works the most, actually. Because
I believe it.
through all the end pieces, and the tips. So it's the machine who works the most.
Final thoughts, Dr. Irini, on the same topic?
Yeah, exactly the same with Dr. Fournier. I even bought two now because like the other EXION machine is already break even like 6 months, and then it was like so busy, so I got another one. So yeah, I think like the one that I sort of like present, having like this EXION, and then especially with the additional of clear RF, really helps with the clinic growth. And then I gave like some tips if like using AI, and then how we sort of like using like the new technology to improve like the clinic growth. And then what I'm happy with like BTL, you are the leader. I mean, BTL is like the leader of like new innovations. For example, like when they launched like an M-Face, it's like the first device that tackle aging through muscles. And then now they ace it again with this AI device, and then the first microablations with monopolar RF, because previously it was just lasers. And then we're utilizing what's there in the market, because we're not the inventors. You are the inventors. BDL is the inventors. So I was always excited when you guys have like a new stuff, because I know usually it's very niche, and then it's like no other companies ever thought about that. It's totally brand new. So like my last message, so when there's like a new one, be the first to get it, because you will lead the game, because you don't have to worry about price comparison with other clinic, the competitions, because if you're leading the game, you are the trendsetter, you set the price. So that's what I did. So that's why I aced with EXION, because I got it first.
I love that.
Yeah.
I've appreciated today. This has been one of the best webinars I've experienced. Dr. Arini, thank you. Dr. Fournier, thank you so much for your time and for your knowledge and honestly your energy. And it's just been a beautiful, beautiful webinar that we've had today. And I thank you both. Thank you, BTL, for hosting this brilliant webinar. And for all of you around the world, thank you all for joining BTL. And we always wonder, what does BTL stand for? The theory that I like the most is be the leader. And if you haven't heard anything about that today, of course, lead this initiative with BTL when it comes to tightening skin, when it comes to pigmentation of skin, when it comes to enhancing the confidence of your patients. Every day, we thank all of you for everything you do. Thank you, Dr. Arini. Thank you, Dr. Fournier, for your time. It was a pleasure, as always. For those of you around the world, we hope you stay safe, and we are honored to have you along this journey of leading this industry. Thank you all for your time. Take care.
Thank you, Dr. Patel. Thank you.
Everyone. Thank you.
Thank you very
Take care.
much.
Bye.
Bye.